along with some colleagues in Canada, we developed a study called the Value Study, where we set out to determine the value of liquid biopsy added to routine tissue testing in patients with advanced lung cancer who we thought were more likely to have genomic targets, patients who were never smokers or had a less than 10-pack year smoking history. Over the past year and a half, we've accrued 210 patients. 150 of those are treatment naive or have stage 4 lung adenocarcinoma or other non-squamous, non-small cell lung cancer subtypes. And 60 of the patients are patients who are refractory to targeted therapy. So they have a known pre-existing targetable abnormality, but they failed a standard TKI. And in particular, we tried to eliminate patients that would have needed T790M testing. And so this was really people who had were negative for T790M or had failed osimertinib. So in the study, we were really delighted to see that the vast majority of our patients got a result from liquid biopsy. The results were faster, about 8 days compared to nearly 20 days based on tissue testing. And in 54% of our patients in that particular patient population, we actually found an actionable target and were able to get patients to targeted therapy. When we looked at outcomes with targeted therapy, whether we found the target in blood or in tissue, response rates to targeted therapy were very similar, 75% with liquid biopsy and 64% with tissue biopsy. And for patients with non-targeted therapies, the response rates to treatment were also very similar, whether their testing was confirmed using a liquid biopsy approach or a tissue approach. When we looked at the group of patients that had failed targeted therapy,